Welcome to the African Americans in STEM with the Reginald F. Lewis Museum. My name is Terry Taylor, and I work in the Education Department at the museum. Today, we will learn about African American men and women from our museum galleries that work in careers in medicine in the state of Maryland. Here is an image of the Reginald F. Lewis Museum building from the outside. But let's go inside to meet our first person. When you see this image on this wall, what do you see? This is a picture of young Esther McCready in a nurse's aide uniform. She's the one with the glasses. Her dream as a teen was to become a nurse. She desired to go to nursing school in Maryland, but wasn't allowed to because of the color of her skin. Can you imagine? To become a nurse, she had to go to a nursing school out of state. But she decided that she was going to apply to the University of Maryland Nursing School and was rejected, even though she had the grades and qualifications to be admitted. She took her case to court, and with the help of civil rights attorney Thurgood Marshall, and Don Murray, she got the school to admit her in 1953. That's the picture of her right there in the middle with Thurgood Marshall and Donald Murray. When you look inside this glass case, we see objects that belong to Esther McCready and tell about her fight to become a nurse. You may see her nursing cap at the top of the case, a photo of her in a nursing uniform, and her nursing school yearbook at the bottom of the case. These objects speak of her achievements to make her dream come true. One of the documents in this case is her acceptance letter from the University of Maryland Nursing School. She became the first African American admitted to the University of Maryland School of Nursing in 1950. But although she was able to attend, she had some challenging times. She was not allowed to live on campus. She had to travel to school every day from home and was sometimes treated unfairly by her professors and classmates. But she did graduate from the University of Maryland with her nursing degree and had a career as a nurse for over 17 years. The award at the top, that black plaque, that was given to her from the Black Student Nurses Association for all her hard work to become a nurse. On this slide, we see Esther McCready in her nursing uniform as a young lady, and later as an older lady, next to the items that we just talked about. She gave all of those objects to the museum as gifts. The museum thinks Esther's story of becoming a nurse was very important for us to tell our visitors. And hopefully it will encourage them to go after their dreams too.
Hello everyone. I hope that you enjoyed your tour of the Reginald Lewis Museum of Maryland African American History and Culture. I'm Albert Lewis, an educator with the University of Maryland Extension, Baltimore City 4-H. This is the Blacks in STEAM Matter program. The Blacks in STEAM Matter program highlights people of color all over the nation involved in STEAM professions. The goals of the program are pretty simple. We look to engage and encourage youth to participate in STEAM programs. That's science, technology, engineering, art, and math activities. Through these activities, youth learn various skills to help them have fun and learn various STEAM topics. We also hope to expose them to the various STEAM careers and also various STEAM professions of color. The long-term goal is to inspire youth to pursue careers in STEAM professions. For those of you who are not familiar with 4-H, 4-H is a youth development program that helps youth develop into positive adults. The 4-H's are the head, the heart, the hands, and health. 4-H programs begin with the 4-H pledge, which reads as, I pledge my head to clearer thinking, my heart to greater loyalty, my hands to larger service, and my health to better living for myself, my community, my country, and my world. How are the 4-H's applied to a young person's life? Well, pledging my head to clearer thinking means that youth gain knowledge and skills such as robotic skills, engineering skills, math skills, that help them make proper choices. Pledging my heart to greater loyalty means I'll be a better friend. I'll be responsible. Pledging my hands to larger service means I'll help my community. Maybe I'll start a recycling program, or pick up litter, or help my neighbor. Pledging my health to better living means that youth will strive to eat healthier, to be more physically active. Have you ever heard or seen an ambulance or fire truck ride down the street? These people are part of our emergency medical services. Our STEAM topic for today will cover the emergency medical services and basic first aid for kids. We'll be also highlighting Esther McCready, a nurse, and Breonna Taylor, an EMT. Our STEAM activity for today will cover the emergency medical services, which include EMTs, or emergency medical technicians, and paramedics. We will learn about the skills needed for these careers. We will also discuss Esther McCready, an African-American nurse, and Breonna Taylor, an African-American emergency medical technician, or EMT. Our activity for today will have us learning and practicing basic first aid skills. Those persons working for the emergency medical services are considered first responders. These are men and women who are first on the scene of accidents, medical emergencies, and natural disasters. You may see them on ambulances, on fire trucks, within the hospitals, and even helicopters. They're considered EMTs, emergency medical technicians, or paramedics. Emergency medical technicians, or EMTs, are the most common type of providers seen in emergency situations. Many paramedics, doctors, nurses, and firefighters begin their careers as an EMT. An EMT's training includes several topics, such as CPR, or cardiopulmonary resuscitation, giving patients oxygen, administering glucose for diabetics, and treatment for asthma and allergic reactions. EMTs are not allowed to give needles nor medication. Paramedics, which are more advanced in training than EMTs, they learn anatomy and physiology, they learn about cardiology, or the study of the heart, they learn about medications and medical procedures. They're able to administer medicine, they can start intravenous lines with needles, they provide advanced airway management, and also help patients with heart attacks and traumas. There are 4 basic steps or requirements for becoming an EMT or a paramedic. The first requirement is a person must be at least 18 years of age. They must attend and complete an EMT or paramedic education course. They must then pass a test, either the paramedic computer exam or the National Registry of Emergency Medical Technicians exam. After completing the exam and passing the exam, they must apply for certification as an EMT or a paramedic within 2 years. An EMT's education or curriculum consists of 4 parts. There are lectures and assignments on the fundamentals of emergency medicine. They apply these lessons and assignments learned through hands-on skills. They then take written exams to reflect upon their education. They also take ride-along shifts on an ambulance. This is cool because they actually get to work with real patients. Breonna Taylor was a 26-year-old African-American emergency medical technician from Louisville, Kentucky. She was fatally shot by police officers March 15, 2020. Her mother mentioned the fact that Breonna had big dreams to pursue a lifelong career in healthcare. After serving as an EMT, she had plans on becoming a nurse. During the tour at the Reginald Lewis Museum, Miss Terry highlighted the exhibit featuring Esther McCready, a nurse from Baltimore City. Nurses perform various medical care. Some even believe that nurses are more impactful on patient care than doctors are. Nurses provide a variety of care for patients. It may include bathing and dressing a patient, changing wound dressings, taking vital signs. Registered nurses can also give medication and perform basic procedures. A nurse's training may span between 1 year and 4 years, depending on the program. Nurses can also be trained to deliver babies, to give anesthesia, and also work in special areas such as pediatrics with children or geriatrics with older people. Having basic first aid knowledge is important for everyone to learn. These may include calling 911, creating a first aid kit, controlling bleeding, even some family-specific emergencies, hands-only CPR, and stop, drop, and roll techniques for fire emergencies. We're going to practice these skills during the STEAM activity today. Basic first aid skills can allow you to help assist people with head injuries, broken bones, burns, bleeding, and even choking or possibly heart attacks. One of the first things you must learn when learning basic first aid is calling 911. You must understand that calling 911 from a cell phone or from a house phone or landline may be different. A cell phone usually has a button that says emergency calls, whereas a house phone or landline must actually dial the numbers 9, the number 1, and the number 1 again. We must also understand what to say when the emergency operator asks us why we need help. Several responses include giving the reason for the call, giving our full name, giving our address or location, and describing the location so that the EMTs can find us. Let's take a few moments to practice calling 911. For instance, doot, doot, doot. Hello, 911 emergency. Yes, hello. My mom was burned in the kitchen. She spilled some grease on her. Hello. May I ask who I'm talking to? Yes, this is John. Hello, John. Please take a moment to calm down. What's going on? My mama, she burnt herself in the kitchen. She spilled some grease on her arm and she's screaming and yelling. Okay, John. We're going to help you, okay? We're going to send someone to help you. What is your location? I'm at 116 Springfield Lane. Okay, John. Is that a home or is that an apartment? It's a house. Thank you, John. Do you know anything that's located nearby? Yes, it's near the 7-Eleven. It's near York Road. Thank you, John. We'll send someone right away. Stay on the phone with me, okay? And we'll walk you through it. How's your mom doing? Is she able to talk? Is she okay? Yeah, she is. She's just screaming. She burned herself, and it looks really bad. Please come help me, please. Okay, John, we're sending someone. They should be there shortly, okay? Thank you very much. Hurry, please, hurry. Another simple and basic first aid skill we all should learn is where our family's first aid kit is located. Does your family even have a first aid kit? Do you know where it is? We must also understand and teach our youth that emergency kits are not toys. They're for emergencies and not to be played with. Okay, enough of this talking. Let's get moving. Let's have a scavenger hunt. See if you can find any of the items listed below. These items are important to make up a first aid kit. See if you can find a first aid kit, if your family has one. First aid information. Do you have bandages for your boo-boos? How about a thermometer? Do you have gauze squares? Hydrogen peroxide? Adhesive tape? Remember, check the freezer for an ice pack. Do you have rubbing alcohol? Do you know where the scissors are? What about soap? Or tweezers? You may need those if you get a splinter. Do you know where the cotton balls are? How about calamine lotion in case you get poison ivy? Also, it's good to have a pair of disposable gloves as well. These items are very important for emergencies, especially during the pandemic we're having right now. Some of these items can be very helpful. Another basic first aid skill we all should learn is controlling bleeding. Controlling bleeding involves applying direct pressure to a wound by covering it with gauze pad, a paper towel, clean cloth, or article of clothing. Make sure you wear gloves or a plastic bag over your hands just in case the blood soaks through to protect yourself. Cover the wound and apply continuous direct pressure until the bleeding stops. Raising the arm or the bleeding surface may also help control the bleeding as well. Make sure you wash your hands before and after helping someone. Another first aid skill we all should learn is hands-only CPR. CPR stands for cardiopulmonary resuscitation. Hands-only CPR provides resuscitation without giving breaths. The first step in hands-only CPR is calling 911, like we practiced earlier. The second step includes interlocking your hands and fingers and pushing hard and fast on the person's chest at 100 beats per minute, like the song Staying Alive. Hands-only CPR involves placing the heel of one hand on the person's chest and place the other hand on top of that one. We then push hard and fast in the center of a person's chest at 100 beats per minute. Try to keep your shoulders positioned directly above your hands and keep your arms straight. Okay, now it's your turn. Take some time to practice hands-only CPR. Remember, place one hand in the center of the chest, the other hand over top of it. Keep your arms straight and press down hard and fast at 100 beats a minute. Hands-only CPR, we place one hand, the heel, in the center of the chest, the other hand over top of it. We keep our arms straight and we press down hard and fast at 100 beats per minute. This helps the heart pump blood through the body. This allows blood, oxygenated blood, to get to the brain. So I want you to practice this at home as well. Unfortunately, sometimes when we're outside playing, or we may just trip and fall, we may break a bone. It's important to know what to do during this situation. If we break a bone ourselves, or we're with someone who may break a bone. The first thing to do is to call for help. Ask for help from an adult, and also call 911. Ask the person where it hurts, but it's important, do not move the injured part. Talk to the person to try to keep them calm. It's important also to make sure the person doesn't eat or drink anything, because the hospital may have to take x-rays, and eating or drinking may obscure or block the x-rays. Stay with the person to keep them calm and let them know that you're there for them. Ah! My clothes are on fire. Do you know what to do when your clothes are on fire? Our first reaction is to run, to panic. But when you run, this adds oxygen to the fire, causing it to spread. Try to remain calm. Stop. Stop where you are, then drop to the ground. Cover your face with your hands and roll over back and forth until the flames are out. When you roll, this smothers the fire, putting the flames out. Also, get help from an adult and call 911. You did a great job. I hope that you enjoyed this theme activity. I really hope that you learned some basic first aid skills. If you have any questions, have your parents contact me at my email, alewis17@umd.edu. I also ask, if you take any pictures or recordings, please send me a copy. I would love to see your skills in action. Have a great day.